Some of the big differences between urgent care and the ER is, I would say one of the biggest differences really is the wait time. When you come to urgent care, the average wait time is around 45 minutes, whereas if you go to the ER, it's more like 247 minutes. So some of the common things that we see in urgent care, and we're absolutely capable of treating, are ear infections, strep throat, influenza, common lacerations that need to be stitched up. That's something we can absolutely take care of. Broken bones, twisted ankles. Those are just some of the many things that we take care of. Urinary tract infections is a really common one.
Urgent care has specialists that deal with sports medicine injuries, which is what our family tends to use the most of, and that's why we tend to go there. I know I can get an x-ray really quick, that they'll be able to read it effectively and get them on the road to recovery, and they have they have follow-up. They're very good about calling, which is really nice when you get the phone call to find out how they're doing. They'll need follow-up. They know what paperwork that they need to fill out, because the coaches need paperwork, the club directors need paperwork, and they know all of that to fill out, so it just makes it much nicer than having to go to an emergency room and then try to track down paperwork.
There's definitely a time and a place for the ER. Yesterday I sent a patient to the ER, a patient that was a type 1 diabetic. His sugar was excessively high, and he was severely dehydrated. So in this case, the patient needed IV fluids and to be hospitalized, and additional imaging studies that we can't offer. In those cases, the ER is definitely the place for them. Recent statistics state that there's between 8,000 and 9,000 urgent cares in the U.S., and there's many here in Arizona as well, scattered throughout the valley, and there's way more than people imagine. So it's something that they can go in that day, get taken care of, and leave with an antibiotic in hand sometimes.